Hello all, thank you so much for joining Edge's webinar on the benefits of remote talent for medical organizations. Today, we're going to discuss how you as a practice owner or administrator are able to maximize operational efficiency, specifically when it comes to staffing employees in the front or back office of your practice. To give a brief agenda of what to take away from this specific webinar, we're going to highlight the negative trends that are affecting practices, the impacts of those trends, and a solution of remote talent that is able to take away from some of these trends that are affecting practices today. The number one reason why practices are overwhelmed when it comes to staffing today is because there are 1.5 million fewer Americans participating in the labor force. Oftentimes, practices or healthcare organizations are using resources in their local market to find employees and are dealing with a 3+ month duration to actively fill open positions. This is directly affecting those employees that are already in the practice, leading to burnout, leading to feeling overwhelmed, and ultimately leaving themselves. On average, with hires within the local market, we're seeing a less than 12-month duration before a employee typically turns over. And 12+ months is actually on the lucky end. Usually the duration of a front office employee that is hired in 2023 through the beginning of 2024 is 3 to 6 months on average. Now, when we look at some of the impacts of being short-staffed for practices today, it directly relates to the patient experience. Unhappy patients directly equals an unhappy practice. What we have seen from staffing shortages is that it directly relates to an increased wait time for patients, a diminished patient-provider interaction, and ultimately directly affects the patient satisfaction scores over there. The employees that are left in the practice to deal with this are feeling high levels of burnout, ultimately increasing that turnover, with administrative tasks often being the reason that they are feeling this level of burnout. To have to answer the phone, deal with patients in person, but also do 15 to 20 hours of paperwork daily are the main reasons why employees are not satisfied today, and ultimately practices are feeling the burnout of being short-staffed. When we consider what solutions are out there, remote talent is the number one reason why practices are able to get past this issue. Some of the benefits of partnering with a global talent organization are that you're able to attract a significantly larger talent pool while reducing overhead costs. The employees you have in person are able to focus on patient care, while your remote employees are able to take care of all of the administrative tasks. What this does is it improves performance, productivity, and ultimately results into a more engaged workforce that will be there for the long term. Now, regardless of practices going towards remote employment over the last several years, what we're finding is still a reluctance to adopt this type of employment. When we consider the opportunity cost of not going remote, you are still dealing with a very limited talent pool in your local market. Due to this, you're dealing with burnout, turnover, and overall dissatisfaction amongst your employees and patients. And because you're having to constantly hire, train, and you're dealing with retention, there's an increase in costs that the practice is not able to sustain. Partnering with the appropriate talent partner is a very, very vital step in your overall practice's success. When partnering with a talent organization, you're going to want to make sure that your onboarding and quality control are top tier. Ensuring an organizational partner is able to provide the same type of onboarding that you would provide an in-person employee is extremely important. Ensuring you're partnering with an organization that is HIPAA compliant, but also that provides HIPAA compliant individuals is also very important. And last but not least, being able to guarantee retention. is extremely important to ensure that your practice is able to focus on patient care and given the best possible outcomes. When it comes to Edge specifically, I'll walk you through what our process looks like and how we're able to guarantee success for our practice partners. Edge in itself works in three different structures: hiring, training, and co-managing employees that belong to your practice. On the hiring front, we are receiving thousands of resumes daily, individuals with a minimum of a bachelor's degree, with the high level of them being directly experienced in medical care, going to medical school, and potentially being physicians themselves, who are looking for a full-time opportunity with a US-based medical practice. Once someone goes through our Edge program, they are now put into our Edge Academy, which is a 5-week training course going over the high level of US-based healthcare, but the day-to-day tasks that they would be performing as well. Once you have interviewed candidates and ultimately have selected someone to join your practice, they become your full-time employee. They would directly report to you and only your practice. And ultimately, the management level will be the exact same as an in-person employee. The ultimate goal for Edge is to not only connect you with an extremely talented individual, but for that individual to be able to spread their wings and truly be a member of your staff for a long period of time. Now, when we consider what that Edge Academy actually looks like, again, it is a 5-week training course focused amongst medical modules, readings, HIPAA compliancy and trainings, and ultimately quizzes that allow the quality of the candidate's work to be highlighted. The goal of this is to provide foundational skills to be able to lower that ramp time and ensure that this individual is the right type of fit for your practice. When we consider some of the ways an Edge employee is able to directly affect patient care, we break it down into pre, during, and post care. Pre-patient care includes an Edge employee being able to take care of your scheduling, take care of intake, and insurance verification and or pre-authorizations. During care, they're able to help with lab orders, medical scribing, and submitting claims. And when we consider post-care, claims follow-up, overseeing the referral process, and being able to help your billers with support are just some of the ways an Edge employee is able to help your practice. Overall, with Edge, we have a couple of different goals when it comes to partnering with our practices. Speed to impact is a key concept for us. As you interview candidates and are selecting multiple individuals or one to join your practice, the average time to have them live at your practice is less than 10 days. Again, speed to impact is a priority for us in ensuring our practice partners are able to be successful. You're able to save at least 50% on costs such as recruiting, salaries, benefits, and last but not least, you are able to guarantee a 97% level of retention at your practice. If you are interested in learning more, please feel free to reach out. We'd love the opportunity to walk you through the Edge process, learn more about your practice, and overall show our value to you as a remote talent partner. Thank you very much.